Okay, we will continue the prostate cancer, part 22, immunotherapy. We have Sibulacil T, that's the US brand Provenge, as you see here, Sibulacil, Provenge. And this is the Sibulacil T stimulate the patient immune system, as you see there one. This is the starting resting ABC, and also here this is the day 2 to 3 antigen combined to the antigen presenting cell. Antigen presenting cell take ups by BAP, GMs, that's the granulocytes, CSF, and then process to start. And here this is the D3 to D4, have inactive T cell and active T cells. That's why it's called Sibulacil T stimulating immune system. Process repeated weekly over 3 to 4 weeks. Sibulacil T is a autologous cellular immunotherapy. Sibulacil T is FDA approved for treatment of asymptomatic or minimally symptomatic metastatic castration-resistant prostate cancer. If asymptomatic or minimally symptomatic castration resistance, we can use Sibulacil T as autologous or autologous cellular immunotherapy. Sibulacil T is not recommended in patients with any of the following characteristics. Those using opioid to control cancer-related pain, or those who have visceral metastasis or rapidly progressive disease, or life expectancy less than 6 months, large tumor burdens, and also ECOG performance status more than or equal to small cell prostate cancer, neuroendocrine prostate cancer. All this is actually contraindication to use Sibulacil. Background prostatic acid phosphate is a protein expressed by prostate cancer cell. Granulocyte macrophage colony stimulating factor is an immune cell activator. It's known as granulocyte macrophage colony stimulating factors. During metabolism, intracellular proteins are degraded into fragments. Major histocompatibility complex bind to these fragments, transport them to the cell membrane, and then display them on the cell outer surface, where the T cell can be examined the fragment. In abnormal cells, some of the degraded fragments arise from foreign or aberrant process such as viral infection. T cell will kill a cell that display foreign or aberrant fragments, but will leave alone a cell that display normal fragments. However, T cell can be programmed to kill cells that display any fragment, including normal fragments. Antigen-presenting cells, as the ABCS, are immune cells, example, enteric cell or B lymphocytes. Antigen-presenting cells use the major histocompatibility to present antigen to T cell, where the ABC present antigen to T cell. It programs the T cell, to recognize and kill cells that express that antigen to their surface. Preparation leukocytes are obtained from the patient by leukophoresis. The leukocytes are centrifuged to isolate monocyte antigen-presenting cell. The antigen-presenting cell then incubated with PAP, that GM-CSF fusion protein. During incubation, ABC internalize the PAP GM-CSF protein and degrade into the fragment. These fragments are mounted onto MH, that the major histocompatibility protein, and then major histocompatibility protein are transported to the cell surface. Ultimately, the BAP granulocyte MSCSF fragments are presented on the ABC cell surface. The ABCs are loaded with BAP GM-CSFs. The ABC with BAP GM-CSF fragment on their surface are active component of cellulose T. Mechanism of action the exact mechanism of action for cellulose T is unknown. However, the following explanation is hypothesized. In vivo, the cellulose T ABCs show that the BAP fragment to the T cell and program T cell to see and destroy any other cells that express BAP fragment on their surface. Since BAP is highly expressed on their surface of prostate cancer, the programmed T cell attack ELISA prostate cancer cells. This is the leukocytes are obtained from patient by leukophoresis. The leukocytes are centrifuged to isolated ABC, that's the antigen-presenting cell, and here the ABC are incubated within the infused or infusion protein. The fusion protein is taken up into the antigen-presenting cell, and here this is the antigen-presenting cell taking the ABC, and here this is the major histocompatibility, and fusion protein is degraded into the fragment. That's the fusion protein is degraded to fragment, and then is a fragment of BAP bind to the major histocompatibility complex. And the major histocompatibility complex with BAP fragment is moved out of the cell. Moving out, then a loaded ABC are infused into the patient. Then the ABC program T cells to lyse other cells that have BAP fragment on their surface. And as you see, the T cell, the prostate cancer, and here the T cell find the BAP fragment on the surface of prostate cancer and lyse the cancer cell. Lyse the cancer cell, and the T cell did the function. This is a possible in vivo mechanism of action. As you see, this is T cell, BAP peptide ABC, activated T cell, and as you see, activated T cell lyses the cancer cell. Activated ABC involved present the BAP peptide to the T cell. T cell recognize the BAP peptide as evidence of cancer and become activated. Activated T cell recognize the BAP peptide on the surface of the cancer cell and mount an attack. Administration of cellulose T is administered as 3 infusions. The interval between each infusion is usually 2 weeks. 3 days before each infusion, the patient undergo leukophoresis. The ABC obtained during leukophoresis are sent to a special laboratory where they are loaded with BAP GM-CSF. The loaded ABCs are sent back to the clinician. Certain oral antihistamines such as diphenhydramine to minimize infusion reaction. Cellulose T is infused over 60 minutes. Cellulose T infusion is performed without cell filter. Efficacy Sibulacil T improve median overall survival by approximately 4 months compared to placebo. Both HLC analysis of randomized study and observational registry show that the overall survival benefit is greater when Sibulacil T is administered at the low BSA level. This benefit was seen even at BSA less than or equal 5.27. Sibulacil T does not lower the BSA dose. Sibulacil does not lower the BSA, does not reduce the measurable tumor burden, does not improve time to progression. This is Sibulacil. Sibulacil T improve overall survival but does not alert any of measurements that are used for monitoring prostate cancer. Side effects within 24 hours of infusion are common and usually consist of mild to moderate chill, fever, fatigue, nausea, joint pain, back pain, headache. These symptoms are usually resolved within 2 days. Rare serious side effects include stroke, MI, DVT, BE, severe infusion reactions. Timing of administration, the beneficial effect of the Sibulacil T is thought to be dependent on intact immune system. Thus, it was assumed that the Sibulacil T would be less effective when administered with immunosuppressant, such as steroid. However, preliminary data suggest that efficacy of Sibulacil T may not be compromised by co-administrations with steroids. We'll come to pembrolizumab. It's also immunotherapy, and as you see, a dose of 100 milligram per 4 months is infusion only. The progranulin receptor 1 is located on lymphocyte. When certain protein bind to the progranulin receptor 1, the immune system system has reduced capacity to attack normal tissue, reducing the autoimmune reaction, and reduced capacity to attack malignant tissue, hindering the body's ability to kill the cancer. Tumors that have a deficient DNA mismatch repair system tend to generate protein that bind to PD-1, which means they can hinder the immune system ability to kill the cancer. Mechanism of action of pembrolizumab is a therapeutic antibody that blocks the binding of protein to PD, that the progranulin 1, which gives the immune system greater capacity to attack the cancer. However, the increased immune activity can also result in attack on normal tissue, which lead to some of its side effects. Pembrolizumab is often called an immune checkpoint inhibitor because it is block an important regulatory component of the immune systems. This is a pembrolizumab targeted PD-1 antibody, antigen presenting cell or tumor cell, as you see, is targeted these receptors. This is the medication. Pembrolizumab blocked of co-inhibitory signal, so it will lead to block of this receptor, as you mentioned here, that the pembrolizumab mainly act on progranulin receptor. This located in the lymphocyte. So this pembrolizumab therapeutic antibody that block the binding of protein to progranulin cell or non-progranulin receptor 1. Progranulin receptor 1 or progranulin lymphocyte 1 and 2. Pembrolizumab is FDA approved for treatment of metastatic tumor that have all of the following characteristics. If microcyclic instability high, that's MSI, MSIH, deficient DNA mismatch repair, cancer progression after prior therapy, no satisfactory alternative treatment option. For prostate cancer, pembrolizumab is a treatment option for tumor with dMMR or MSHH who have failed at least one therapy for metastatic CRPC. Side effect, common side effect, fatigue, musculoskeletal pain, diarrhea, nausea, decreased appetite, rash. And also pruritus, fever, cough, dyspnea, constipation, abdominal pain, peripheral edema, infusion-related reaction. Less common side effect, immune-mediated side effects such as pneumonitis, colitis, hepatitis, thyroiditis, pituitary inflammation, and nephritis. Dose pembrolizumab is administered intravenously, and as I mentioned previously, you can see the prescribing information for dose and administration. Monitoring during therapy, monitoring should include serum creatinine, electrolyte, glucose, LFT, thyroid function test. Okay, thank you very much. This is the end of part 22.